Hello and welcome to Medical Today with me, Jared Ratnam. This is episode 5, season 3.0. Have we got a show for you? Yes, we do. We'll be talking a little bit about neonatology later. If you don't know what that is, stay with us. We'll also be looking at a parent's first journey. Later on in the show, of course, we have a video for you in first aid mistakes. We'll be taking a look at dehydration and how one can deal with that. But to kick off today's show, as always, we're trying to improve health and enhance lives, and to do that, we understand that there are a lot of people out there, me included, always dealing with back pain. Lower back pain is a big problem to most of us living urban lifestyles. Now, how do we deal with that? Joining me in the studio is Shah Zarak Khan, Group Managing Director of Photomedic Solution, Sendirian Berhad. He's seen a lot of back pain in his life. He's going to talk to us through it and also talk to us about laser and how lasers are being used to help with pains and aches. As Shah, thank you very much for joining us on the show. It's a pleasure to have you here in the studio.
Thank you, Gerard.
Well, an interesting morning I had. Walked into the office this morning. You came in with that contraption, and we had a little bit of a demo as to how that works and how it alleviates pain, whether it's in your back or in your knee, so on and so forth. So you've been doing a lot of research with regards to this. When you bring something like this to Malaysia, I guess the big problem is people start to question it. Do these things work, so on and so forth? Now with lasers, let's go back to what we were talking about before again and talk about when it first came into the country, people were skeptical about it at that point. Why was that?
Yeah, thanks, Gerard. Okay.
Was that too much of an intro?
Okay. All right. Basically, just like any other new technologies that actually involve, whether it's robotics, and so forth, right? There's always a skeptical points, right, before someone actually believes it, right, that it actually works, right? One of the challenges was that basically it was hard to believe that basically lasers assist patients to heal at a very much faster rate. Right? We use the term healing with the speed of light. Right, meaning to say that patients have a chance to basically, after pre-diagnosis of whatever elements that they have, right, whether they have a sciatic situations or anything related to back pain, normally they have to do a pre-assessment. And after the pre-assessment, you apply the lasers on the correct areas of the pain areas from proximal to distals, and you basically helps to accelerate the healing process itself.
Now, people are doing anything and everything. They visit osteopaths, they visit chiropractors, they do dry needling these days. There's just so many things out there when it comes to TCM and alternative medicine. Where does this fall under in terms of category?
Okay, just prior to that, Gerard, just to share with you, I've tried all of it. I'm a patient myself, right? Back more than 15 years ago, I had a herniation of my cervical, and then basically of a lumbar itself. I have gone through 4 months of physio rehab. I've got epidural on my neck, and basically I've tried.
I don't envy your life.
Yeah, in fact, I've done everything what you mentioned just now, and coincidentally I went off to Canada. Right, so there was basically a center that actually put me on this laser treatment just for 5 days, and tremendously I felt lots of different. That's right. Before that, you have been having, for example, back pain for a certain period of time.
I've been having back pains for 16 years. Today, after 3 minutes of using that, and I don't know what you did to me, essentially, it's sort of helping, or it did help alleviate a little bit of that pain.
And how many percent was that?
That was about 50 to 60% gone just like that.
There was only once.
Yeah.
Right, so
and just for the record here, we're not doing an advertorial of sorts. It's just something I really wanted to try. It was just how curiosity kills the cat. I told him, Shah, you've brought this thing in. I really want to see. I want to put it to the test and see how it works. Now, are hospitals warming up to this?
Yes, they are. There are some hospitals still in the process of looking into the I'll call it a gadget, or a tool, right, to see how it actually fit in their practice. But yes, they're actually warming up into it.
Right.
We have quite a number of great hospitals that join us, and I think it's very important for patients to know, right, that they have the right to get a good treatment at these respective hospitals.
So saying if you can release pain for a while, can you reverse that pain?
Well, that's a tough question. Right? I'm still living with pain. All right, but basically I could manage my pain. Right? Those days I can't even lift up my daughter. Right? I can't even lift up my laptop. But today, right, I can basically do all the house chores as well. So basically, what it does is that it gives you a better perspective of life. Right? Although you're injured, right, you can basically proceed with your normal life. So, yeah, it's possible.
It brings you somehow. It brings you back to a little bit of a sense of normalcy to your everyday life. You tend to be able to do the things you used to do. Now, the root causes of back pain, we know that there are some of us, it comes from accidents, some of us just bad posture. What are the main or the major root causes that you hear of all the time?
What was yours?
Mine was because of a fall. I don't know.
Okay.
I don't know, but I have a back pain. And
mine was because of my incident of becoming a mud rempit in Penang.
Mud rempit in Penang.
Yeah.
So I was the price of paying for being a mud rempit.
I was actually, not that exact mud rempit, but actually hit and run case. Right? And from there, I was an athlete, I was a sportsman. And from there, after a certain number of years, I had another fall. Right? And basically that triggered it even worse.
So this was many years ago when you were young?
Many years ago.
So I do believe in karma now.
Yeah.
Karma, it's something that always comes back and visits you at some point. Now, with diagnosing the problem, so for you to be able to help someone, the person has to get diagnosed first by a medical practitioner.
Correct.
How's that done?
All right. Firstly, it's very important that I would strongly advise patients to look for, have appointment with the orthopedic specialist, right? Get the history checked up. Get a certain scan done. You have got MRI, X-rays, possible nerve tests or bone scans.
Yeah, but it can get so tiring. One day it's an orthopedic specialist, then tomorrow if there's something wrong with your foot, you have to see a foot surgeon. There's too many people that you need to deal with.
Well, instead of toying around with too many places, getting yourself self-diagnosed, I call it Dr. Googles.
Yeah.
Right, in the sense.
Yeah.
You've been
do you even blame us for being like that? It's so expensive these days.
It is.
Yeah.
And if you get it done once, you know what's your problem.
Right.
And from there, you can actually take steps to prevent it and basically to heal it.
Okay. Right. So prior to lasers, we were using LEDs and calling LED treatment laser treatment. There was a time, isn't it?
It
started off as LED,
it
therapy.
actually started off with lasers, but what's happening in the industry is that there has been overclaiming of products. Right? Some even stated, hey, my LED works well, right? But actually it's not even LED.
Not even
right?
LED.
It could be just
hoping for the placebo effect to kick in.
That's right. That's right. Yeah. So the actual lasers, as I mentioned, a few times before, that the grades are very, very important because once you can have a good grade of lasers, using it to apply for the particular treatment, right, the healing starts kicking in faster.
Right. So now, when you talk about treatment, old school treatment, how did we in the past deal with back pain?
Okay, reminding of old school, remind me of my mom. Right, she had a fall. I was still a kid. She had a fall, and today she had 4 surgeries done. But just because of the first failed surgery that she has undergone, it actually proceeded to the 4th stage of surgical intervention. The old school method are almost similar to the current method, but the similarities are basically you have a lot of improving technologies. Those days, patients do not have source of information, right? But today, patients have source of information, how they can actually look into proper exercises itself, right, to basically prevent further things from happening, right? So, what would you do? I mean, ask yourself as a patient. Firstly, you have a back pain. Hey, I have this back pain. I'm going to use probably a brand of rubbing an ointment on your back. Then
so
you go to the
we're
GP
usually
clinic.
using ointments, painkillers, anti-inflammatories. Yeah, that's the basic go-to.
That's the basic goal. But those days, painkillers, are different than current.
Right. So with all the treatment that we have now, with the possible treatments that we have available, when you use laser therapy for pain, how does it help with the inflammation?
Okay.
Essentially, it is bringing down the inflammation.
Yeah, it is. It works on basically 3 areas of it. One of it is that once you have a good laser penetrated into the tissues, right? Depending on which area of the lumbar they actually apply on. Example, L4, L5, or L5 or S1. Right? So you have got a string of nerves that is actually coming surrounding it. The lasers produces nitric oxide.
Right.
All right. With that up to about 700%. This is actually published in the Lancet. Right? Not all lasers do it. Right? Only certain lasers actually do it.
So it's published in the journal, The Lancet.
In the journal Lancet.
Yeah.
Right. Under the pain and journal, research journals, and it works with the mitochondria. Right. It works on the ATP cycles itself, and it basically helps to reverse the pain signals that's actually transmitted.
So you mentioned 2 things here: mitochondria and ATP cycles.
ATP cycles.
Can you very simply explain that to us?
Okay, mitochondria is basically our cells. See, when the lasers basically transmit the radiations into the tissue, so you have got inflammations around the tissues itself, right? Lasers works with inflammations, right, and the cellular pathways. And when the cellular pathways absorbs the energy from a particular laser, it helps to repair. Right? It helps to basically work on the ATP side, where it also expand your blood flow to the area where it's injured.
Right.
And
No, so, see,
self-healing.
Yeah, but the thing is, when you mention laser, the thing that comes to mind is there any radiation involved? Are there side effects, so to speak?
Well, it's a positive radiation.
Positive radiation.
It's a positive radiation. The
So
side
you go back
effect is
feeling all happy?
let's not go far. Right. How was the side effect post-treatment when I done it with you?
Okay, yeah, it was good. I didn't feel anything. Maybe 10 years from now, I don't know what's going to happen, but yeah. But as of today, he tried a little something on my back. It did sort of work, and yeah, we'll find out in 10 years if there's any side effects.
Yeah. So the side effects basically is positive.
Yeah.
It helps your body to regenerate, and basically as you need to have lasers at least a few sessions.
Right.
Not once. No, there's a program that we have to put you into place, and basically with those particular programs, you are in a much better pathway of healing.
Okay, now there are different modalities. You have cryo, ultrasound, and of course laser therapy, a little something we have in front of us here. Which one works better?
Okay, cryo is basically from the term we call icing.
Icing,
right? Ultrasound is the terms that we use sound waves to basically get into the tissue, and lasers are basically transmitted of different wavelengths right into the tissue. Cryo, this is something which I'm going to quote, which is actually published on the systematic review publications. There's 35 studies conducted with 22 clinical trials. Not one of them support the use of ice or cryo in promote healing. Ice or cryo, it just numb the skin.
Right.
Right. It doesn't bring down the inflammation. That's what the research says. Right. Whereas ultrasound has been used.
Wait, hang on. Let's backtrack a little bit. You're talking about ice again.
Yeah.
Ice doesn't bring down the inflammation.
Nope.
So what is it?
This is not what I say.
It's numbing it.
It's numbing it. It's just numbing your skin.
Yeah.
Right. There's a laser that has been I will say over-marketed, right, in the industry. This is a wavelength 1064. Right. It works like ice.
1064.
1064 wavelengths.
Okay, I'm going to buy that number. Okay.
Right. And basically, from the studies and research, those lasers do not penetrate more than 4 millimeters. But manufacturers have been claiming that it can go beyond up to 10 cms. That's lots of difference. You see, people have been using lasers wrongly in that sense, and been treating patients in different way, thinking that it actually penetrates. To a certain extent, certain lasers are the same. It works at the same effects like cryo, right? So when I mention again that cryo does not bring down inflammation, this is actually a published article which is available on the Lancet itself, and also on the PubMed.
Right. Now, if you look at laser medicine, what's the future of laser medicine in Malaysia? How far have we come with laser medicine? You said it's taking time to create traction, but are we gaining ground in bringing this into well-being and wellness?
Well, there's a wide future for lasers, right? When you talk about wellness, you're talking about hair regrowth, right? You're talking about oral mucositis, muscle fatigues, right? Many other areas, Parkinson, Alzheimer's, and so forth. Lasers have already come to the stage of artificial intelligence. Right? It can self-diagnose. It transmits sufficient joules, right, enough to your tissues, right, for it to heal well. Right? There's wide scope or spectrum of usage in lasers. Others are basically on fracture healings, lungs inflammations,
Right.
right, tendinitis, gouts. You know, we did one of treatment for staff.
So basically, people who would want to look at laser treatment at this point would be sportsmen, sportswomen, fuddy-duddies like us.
I say, I would say it from a child,
Yeah.
right to geriatric patients.
Right.
Right. That's as long as you're a human being.
We've got about 3 minutes left. What do you have there with you? Yeah.
Okay. This is a unique laser in the sense that it's called K laser.
Right.
Right. It has got the unique part about this is that this is a very high level.
Right. Can you put it back on that?
Oh yeah, sure. All right.
Yeah, just for visual sake.
Right.
Yeah.
This is basically a high level laser diodes that has been used. They are OEM lasers. They are basically low grade lasers, and you have got multiple wavelengths inside here. Right. What the patients, what the medical practitioners need to do is basically click on the required programs, right, of a pain area, right, and basically, and you start treating the patients.
Right.
Right, depending on which area of the pain that you have, right, whether it's
you have to be trained at using this.
Oh yes,
yes.
Oh yes. We do lots of training. We do lots of sharing of research. Training is a must, right? Because this is not a tool that you just actually put it on the table and ask them to use it. No,
right.
There must be a knowledge that actually comes with it. Right, in the
Interesting.
training of laser.
Interesting. Well, before we conclude today's interview, a couple of things I have. One, where can one get information? We're going to come to that. But interestingly enough, you're looking for someone a test subject, and we have, behind the studios, we have a guy called Wahid, who is our switcher. We know him as Mr. Glass.
Yeah.
He's got like a broken collarbone. Everything breaks on him.
Okay,
so you might want to try this on him, seriously, because I'd really like to see its efficacy and how it works. Now, if one wants more information on lasers and of course a guide to how to get started with laser treatment, where can they go to?
All right. We have actually come out with a website. Right, it's patient-centric. It's www.pain.com.my. Right, there's a WhatsApp number over there. What the patients can do is that basically they can basically request for treatment centers, and we can basically share and we'll advise them, and we'll basically look into their history, possibility, and refer them to the hospitals that are applicable where the laser treatments are.
Right, so there are hospitals within the Klang Valley.
Yes.
Also for friends viewing or watching this program, are there hospitals outside of the Klang Valley in smaller towns?
Yes, it's throughout Malaysia.
Throughout Malaysia.
Throughout Malaysia. We have it also internationally, right, in Indonesia, in Thailand, and also in Myanmar.
Right, so once again, the website is
www.pain.com.my.
www.pain.com.my, yeah,
Yes.
and you'll get all the information you need. It was a pleasure and an honor having you on the show, Mr. Shah.
And before I forget,
Right.
so in fact, recently we had quite a number of GPs coming in, right, general practitioners.
Right, so you get clinics offering the services
now. Clinics offering the services at the moment.
Fantastic.
Besides the physio centers.
Fantastic. So get all your information on www.painmanagement.com.my, yeah?
Yes.
And you'll find everything there. In the meantime, we'd like to thank Shah Zarak Khan, Group Managing Director of Photomedic Solutions, Rian Berhad, for joining us right here on Medical Today. Stay with us. When we come back, we're going to take a look at neonatology. We'll be speaking to a Dr. Iqbal, an interesting interview I had on site at the hospital. This is Medical Today on BNC. Hello and welcome back to episode 5, season 3.0 of Medical Today with me, Jared Ratnam. We did have a very interesting first segment talking about laser therapy speaking to Shah Zarak Khan, a guy who's at the forefront of laser therapy in Malaysia. From there, we move on to pediatrics. We spoke to an interesting pediatrician last week. I had the chance to go to KPJ Damansara and to speak to a neonatologist who's a pediatrician, and he deals with premature babies. We also took a look at what an ICU for premature babies is, or is called. It's better known as a NICU or NICU. We'll find out more about that in this interview. Let's take a look at me speaking to Dr. Mohammad Iqbal at KPJ Damansara. Here's that video. Dr. Iqbal, thank you very much for taking time off your busy schedule. I know there are quite a few patients waiting out there, and you've got a long list on clinic days. What is one day like for you in a clinic? How hectic can it get?
It's very busy, but also very interesting because I can get anything under the sun. A child can come in with various ailments. You may be respiratory. You get the usual cough and cold, but sometimes you can get some of the nebulous conditions as well.
Right.
That challenges you. And seeing kids just sometimes also makes my day. That's one of the reasons why I took up pediatrics, because no matter how sick the child is, with the right approach, you can make them smile.
Right.
And when you make a sick child smile, it makes your day.
So before you got into pediatrician, just after doing general medicine, what was it that gravitated you towards pediatrics?
Well, obviously, when you're a medical student, you rotate during various specialties. One thing I noticed about pediatrics is the consultants were much chirper, happier. They have got
so you kind of like that vibe, yeah.
And the wards were brighter, and you got a happy ambience compared to a geriatric ward or an adult ward. And children, as I said, they can get sick with various ailments, but they get better quicker as well.
Right.
And when they get better, I like the interaction that you get when you interact with them.
So generally, you are a person who is very much into a vibe or vibes. Yeah, when your patient walks in, you feel their vibe also. Before,
Definitely. You need to do that. You need to be, and also you need to present a good approach, a happy vibe. Because sometimes a child may be well, but it's the parents that you have to manage. Because the parents may be inexperienced in dealing with simple things like fever. The child may have just a normal viral illness, which all they need is advice on how to manage the fever and what to look for if the child gets worse.
Right.
So sometimes the child is fine, it's the parents that you need to focus on.
So it's interesting that you're a pediatrician and you're also a neonatologist. Maybe let's talk a little bit about what neonatology is all about.
Yeah. So neonatology is a branch of pediatrics. We deal with children or babies, shall I say, who are born early, or babies who are born who are very sick at birth. So premature baby are babies who are born before 37 weeks gestation. A normal baby will born at 40 weeks 37 weeks and above. We also deal with the very premature babies who are born below 26 weeks gestation. These are the very fragile and vulnerable babies.
Right, but having said that, sorry for cutting in. When you talk about neonatology, it's also the facilities that come along with neonatology, which is important, right?
Because these babies are very sick and very fragile. They need help with their breathing, blood pressure. So you need specialized equipment in order to manage them. They can be as small as 450 grams. So a baby can fit in your hand. So obviously these babies are very fragile and immature in their organs. So you need specialized expertise and equipment to manage them.
So from one child to the other, in your area of speciality and subspeciality, it's always a learning curve for you.
It is. I mean, I'm still learning. I've been in pediatrics for about over 20 years.
Wow.
And I'm still learning. You can never stop learning when you are in medicine. And also, advances in medicine force you to learn, to keep it up.
Right.
With the pace of advancements in pediatrics, especially with neonatology. Many things are happening in neonatology. In 20 years ago, babies at 23 weeks hardly survive. Now we have managed to increase the survival to about 30 to 40%. It does mean that majority still don't make it, but it does also mean that those who are hopeless before, there's some hope at the end.
So is it technological advancement or advancement in medicine, or the way the approach is that has brought us to where we are?
It's a combination of both. Obviously, how we know more about neonatology from the research that's been done into it. So we've got specialized, more advanced equipment to manage them.
Right.
We also have more knowledge to understand how babies premature function and what are their needs are.
Right. So when you talk about facilities, I guess you're talking about incubators, IVs, feeding tubes, lines. So the hospital in and of itself should specialize in having facilities like this.
Yeah, in order to manage these fragile babies effectively, you need specialized equipment. You need specialized ventilators. We have one of the most up-to-date ventilators in the country. We also have ventured into areas that not many people venture. For example, babies who are born sick because of lack of oxygen for various reasons, we now have cooling equipment where we can cool the baby's brain to minimize damage that result due to the lack of oxygen when they are in the mother's womb.
Right.
So all this specialized equipment needs specialized expertise. So it comes both, you need equipment and expertise to manage this complex
So
babies.
what you're doing, while it's very technical and it's very intricate, there's also, it needs to be something you love doing. It can't be clinical.
You need to have a passion for it, because these babies are very sick and they are there for a long slog. So a baby born at 23 weeks will probably be in the neonatal intensive care unit for about 2 to 3 months.
Right.
And you need to enjoy what you do because it can be quite intensive.
So you have to monitor them from what we call a newborn ICU or NICU. That's the acronym you use. So you are on call 24 hours. If there's anything, you'll be called back to the hospital?
Yes. The good thing about the setup in KPJ Damansara, there are 2 of us. In some private hospitals in the country, there's only 1 neonatologist. In KPJ Damansara, we've got 2 of us, me and Datuk Musa, and we work with each other.
Right.
So we cross-cover each other so that we always make sure that there's a specialized neonatologist around to manage these babies.
Okay, just running off the grid here and digressing just a little. When you talk about neonatology in the country, how many people do we have?
There are not many of us. From the register, there are probably about 150, 200 of us around. Most are concentrated in the Klang Valley, and most are concentrated in the public hospitals.
Well, if you're listening to a noise in the background, it's all the kids who are waiting out there, and I'm stalling them from coming in. But we're going to speak to a few of the parents as and when we get the time right here at KPJ Damansara. In the meantime, coming back to you. So you have an ICU for newborns, also known as NICU. Now, when does a child need to be put in an ICU or admitted to an ICU?
Yeah, when they're unwell. They may be unwell for various reasons. Most commonly, it could be due to infection, prematurity, or any respiratory problems. So they need help with their breathing. So in the NICU, or the Newborn Intensive Care Unit, we've got specialized nurses who work with me and Dr. Musa to manage these patients.
And are these nurses trained by you?
They are trained by us and also trained, because they undergo a specialized training program set by the Kementerian Kesihatan Malaysia. So all of them need specialized training in order to enable them to know what to do when they manage.
Right. So while they have that general training or the general area of speciality, when they work with you, you have things that you like done in certain ways.
So we do explain to the nurses what are the things that needs to be done, and they also understand from their own training as well, because all of them do undergo specialized training done by community center.
So in your area of specialty and subspecialty, I guess you'll be looking at a lot of jaundice cases, neonatal sepsis. Can you kind of, to say dumb it down is not the right word, but can you simplify it for us?
Right. So in our unit, we have the NICU, which is the neonatal or newborn intensive care. These are the ones that we use to look after the very sick babies. Then we have the special care baby unit. The special care baby unit we use to look after babies who are jaundice. Jaundice is a very common thing. About 80% of babies get jaundice.
Yeah.
It's a very physiological phenomenon. But
in premature babies, it must be a little bit more difficult to deal with, isn't it?
Yes, because they are more vulnerable of getting the effects of jaundice, and more common for them to get jaundice. But what we do is we want to make sure that the jaundice that the babies get are not detrimental to them, because if we're not careful, they can have long-term brain damage from the effects of jaundice. So in our special care baby unit, we have specialized equipment called phototherapy that we can use to minimize baby's jaundice.
Now, I was asking about neonatal sepsis also. Apparently, for those of us who are not in the know, it's a blood infection that occurs in an infant younger than 90 days old. Now, what is the cause of neonatal sepsis, and how do you, as a specialist, detect it?
So, most common cause of early onset neonatal sepsis are infections that the baby gained from the mother. And what we know that some of these babies get Group B Streptococcus infection. So Group B Streptococcus are a normal common cell, a normal bacteria that up to 30% of mothers carry. It doesn't affect the mothers at all.
Right.
But if this bacteria gets into the baby's bloodstream, it can be fatal.
Right. When you say baby's bloodstream, are we talking about premature babies or just...
Or even term babies.
Term babies,
so term babies can get the same infection that premature babies get. Obviously, premature babies are more vulnerable. So what we do is we need to manage them with antibiotics, manage them with hydration, and also making sure that they breathe normally. Because some of these babies may need help with their breathing.
Which brings me to chronic lung diseases or respiratory problems. A lot of the problems that we hear about with regards to premature babies or full-term babies are due to respiratory problems, and with the problems we have with our environment these days, it's becoming more prevalent. Now, what do you see in your area of specialty or subspecialty?
So we get a very varied case mix in our practice. So the premature babies, we get babies with respiratory distress syndrome, and that is a condition as a result of immaturity of the lung.
Right.
So some of the babies may need ventilation to help support the oxygen exchange and carbon dioxide exchange that they need. Some babies are born with this horrible condition called meconium aspiration syndrome. This is a condition where in utero, when baby's in the womb, baby pass motions early, and they take the motions into their lungs. So you get a bit of pool, meconium, in their lung, and that can cause horrendous problems to these babies. And these babies need specialized types of ventilation. More often than not, they may need high frequency ventilation, which we will be able to administer. There are other conditions where a newborn baby may be born with a puncture in the lung for various reasons. And we need to, again, manage babies actively with chest drains, and again, putting babies on ventilation if they are not able to sustain their own respiration. Pneumonia is another condition where we sometimes manage. Most of them are able to be managed just with antibiotics and oxygen, but some are much more affected and needing ventilation.
So I'm guessing by the words you're using, and correct me if I'm wrong here, it can be managed, which means it's going to be a problem lifelong, or it can be reversed.
Most can be reversed in this condition. Most children who have problems at birth can be managed, and their condition can be limited.
Right.
So they don't have the severe effects afterwards. There are some conditions, for example, babies with chronic lung disease, and that is the condition that occurs almost exclusively in premature babies. These babies, when they are born, their lungs are very much more fragile. So these are the babies who tend to have lots of cough and cold more than babies who are born term. So this needs to be managed by their pediatrician long term.
Right. I mean, this conversation can go on for a while because there's just so much to deal with, especially with premature babies, also with full-term babies. But I guess the other important person here would usually be the mums. Now, you know, they would, during pregnancy, they would develop depression, gestational diabetes, hypertension, just so many things can happen during a pregnancy. What are your thoughts on this?
So the mums are normally managed by our fellow OBGYN. So they will be managed by them, and their clinical conditions managed by the OBGYN colleagues. But when they have a baby admitted to the special care nursery or babies admitted to the NICU, they can be under extreme stress and emotional distress. So, and a lot of them, they have no experience dealing with a premature baby. My role with as parents is to bring them along in our journey to make the child better, because it's a partnership. I don't like the paternalistic approach. I want the parents to understand why we're doing the things that we are doing on their babies. Because at the end of the day, it's their baby.
Right.
So I try to explain to them the condition, the treatment, and what are the future outcomes. Sometimes you have to tell them the bad from the good. And this is very important, to be transparent.
Right.
I don't like to paint a rosy picture when the reality is not. And I think being honest, being truthful, being transparent with the parents are very important.
Right. Very quickly, we've got another 30 seconds. To wrap this up, what would be one of your greatest moments being a neonatologist?
I think the greatest moments I have has always been looking at these babies who are very sick, who are at the age of death, coming back 2 or 3 years later, jumping up and down in my clinic, causing havoc. I would love that.
On that note, thank you very much, Doctor. It was a pleasure and an honor speaking to you. Well, I'm Jared Ratnam reporting from KPJ Damansara. We just spoke to Dr. Mohammad Iqbal Sarwar. He's a specialist at KPJ Damansara. So today we've learned about pediatrician or pediatrics and neonatology. We'll try to bring him into the studios at some point to have a bigger and stronger discussion with regards to this. Well, we've heard you talk a lot about pediatricians, pediatrics, neonatology and neonatologists. Now, I guess we need to see you in action for a while. So what we're going to do is we're going to see Doctor do his thing, and I'm just going to sit in the background and be as quiet as I can. Or if I'm lost, I'm going to ask some questions while he's treating the patient. Is that okay with you?
That's fine. That's fine.
Okay. Let's bring in the patient.
Okay.
Yeah.
Good.
Ooh,
Harris?
this is interesting.
Hi. Hello, Harris. Hello. Come in, come in. Hi. How are you? High five. Yay. So, Daddy, have a seat. So, Harris not well today.
Yes,
Yeah. So, what's wrong with you, Sam? Huh?
I was coughing so big.
You was coughing. How long have you been coughing? How many days? Friday? 5 days? That's a long time. So, right. So, you batuk dah banyak lama dah? 2 hari?
Satu setengah hari. Batuk tu macam orang besar.
Batuk kahak ke? Any fever tak? Any
Fever this morning.
this morning? How high was fever this morning?
37 something.
7 something. So, you know, did you take any medicine?
Yes,
What medicine did you take?
I think the green color one.
The green color one. Was it nice or was it yucky?
Nice.
Nice, okay. And did it help the medicine?
Yeah, the fever.
Is this the
went down.
Fleming?
The fever one?
The fever one?
Yeah, it came down.
Uh-huh.
So because of the cough, only running here because of the sound.
The sound. when he slept last night, dia tidur, dia ada terbangun tak daripada tidur?
Sikit.
Sikit okay. Anyone else in the family yang tak sihat?
No.
Dia seorang aja.
Yes, sir.
Have you been away mana-mana ke?
No, only
Tak ada.
daycare.
Daycare. Okay, we'll have a look.
So it's very, very interesting that you're doing this now. Like, if you find out that the child is wheezing, what happens? Do you treat them in-house?
So if the child is very unwell, let's say need immediate treatment, this is not going to be the environment that we do things. We probably need to transfer you to the accident emergency department. I've had a patient coming to my clinic fitting, right? So when that happens, they need specialized equipment which I don't have in my clinic. I would then bring them to the accident emergency department to manage them there. Whereas many children who come to my clinic here are in a setting of, they are unwell but they're not critical. So the cough and colds, the fever, trying to get down to why they're having a fever. Sometimes they are here because of other reasons.
So, I mean,
ache, vomiting, diarrhea.
Doing your investigations is very important. Just while you're talking to them in this 6-7 minutes.
So
Harid looks like a strong man. Can I get a fist bump? Oh wow! Thank you very much.
As
Harid.
they come in, I've already assessed him. You can see how he's breathing. Although he's coming with cough, his breathing is not laboured. So I'm observing how he's breathing, his respiratory rate, whether he's blue in his mouth. So you're doing the assessment as you are having a conversation with him. Betul.
And I also know he's Captain America.
Yeah.
Oh yes! Wow.
Okay, we'll check your temperature like last time. Remember? Check. 1, 2, 3. So fever, okay. When was the last time you give any fever medicine?
This morning.
Morning, tadi tak bagi dah. Okay. May I listen to your chest? Is that alright? Okay. Okay, breathe in and out.
So this is a very important part of what a doctor does. I mean, checking the chest of a child. While it looks so simple, there's a lot that they can derive
Can I look at the
information
chest at
wise.
the back? Okay. Breathe in and out. In and out. In and in. And out. Can you cough for me? Just cough. One more time. Good boy. Good. Okay. Just gonna check your chest. So is there any pain anywhere? No. Okay. Let's have it now. Can I look in your throat?
Wow, you're doing well, man. He's doing amazing.
Yeah.
Oh,
Open your
wow.
mouth. Say ah. Well done. Good. Just gonna check your neck. Right? What about your nose? Can I have a look at your nose? Look up. Looks alright. Good. Okay. So, the lungs looks okay. There's a bit of phlegm in the lung, but there's no serious wheezing. Remember last time when Harid was really bad, dia ada wheezing kan?
Yes.
And masa tu dia punya breathing pun nampak lain. Dia macam macam tu. Dia tak ada sekarang ni. So, sekarang ni the fever is under control, tak demam dah. That was also reassuring. So I suspect apa yang dia ada is a viral infection ke. Sekarang pun kita tengok debu banyak and that may cause them to cough. So at the moment, apart from fever medicine, ada ubat lain tak yang bagi?
Clarinite and then the throat.
Clarity dengan promethazine.
Yes.
So promethazine dah berapa hari dah makan ubat tu?
Promethazine only Aspirin again because there's only one time.
One time. Yang promethazine tu lah?
Yes.
Okay. So I think it's something that you can continue. I know how Harith is. He's got very sensitive airways from previously, kan?
Yes.
So I would continue the Claritin dengan promethazine. Promethazine tu will help him sleep at night.
Okay.
And then what you need to look is the fever pattern tu. Because this demam semalam. So fever pattern tu penting because kalau fever dia sekali sehari ataupun fever dia 2 kali sehari baik dengan sendiri, tak apa. Yang kita risau kalau fever tu berterusan above 38 especially, naik turun naik turun naik turun. So bila naik turun macam tu, dia lebih lemah, lethargic and cough is getting worse, he may need to be seen again. The other thing yang kita nak kena tengok monitor is the wheezing. Kan Harith pernah dapat wheezing.
So while doctor still carries on to speak to Harid, we will wrap this up and of course continue with the rest of the interviews right here at KPJ Damansara. I would like to thank Dr. Iqbal for this short interview and for taking his time.
Harid, nanti kena ambil ubat tau.
Well, that was a very, very interesting video of Dr. Mohammad Iqbal Sarwar, a consultant pediatrician and a neonatologist at KPJ Damansara Specialist Hospital, joining us right here on Medical Today. He has so much fun on a daily basis, but he also saves lives. Thank you very much, Dr. Mohammad Iqbal, for taking time off his very, very busy schedule to join us on Medical Today. We're going to take a short break and come back with more for you right here on episode 5, season 3.0. This is Medical Today. The final segment of Medical Today, as always, in season 3, we bring you a video entitled First Aid Mistakes. And today we're going to take a look at dehydration. How many times have you had a friend or you become dehydrated and the first thing you hand them is a warm beverage like coffee, tea, or even a soda? Apparently that's the wrong thing to do. Now what is the right thing to do when someone is suffering from dehydration? Well, here's a video on what you can do to better your understanding about dehydration and how to help someone. Let's take a look at this video.
The mistake, giving a dehydrated person soda. You can become dehydrated for many different reasons. It could be from sweating too much. Vomiting or diarrhea can quickly remove fluids from your body too. By quickly getting a parched person something or anything to sip, you're making things worse. Avoid coffee, tea, soda, and diuretic drinks, especially alcohol, because they can dehydrate you more. Do this instead. There's really only one way to treat dehydration. Replace the fluids and electrolytes your body has lost. Water is your first choice, but there are lots of special drinks on the market that will help you replace your body's lost water and electrolytes. You can also alternate between 4 ounces of water and 4 ounces of Gatorade every 15 minutes while resting somewhere cool. If you don't feel better in half an hour, don't wait. Call 999 immediately.
Well, now you know what to do in times of a situation when someone is dehydrated or if you're dehydrated. Most of the time when we get to work or when we're home, we have a thirst mechanism, and if we don't drink enough water, we sometimes kind of forget that we're dehydrated, or we kind of lose that feeling of knowing what being dehydrated is. So always take care of your water levels. Make sure you're having enough water at all times. So you can become dehydrated for many reasons. Sometimes it's due to diarrhea, or you're suffering from stomach or food poisoning and you're throwing up quite a bit. So these are some of the reasons why you can suffer, or one can suffer from dehydration. The best way forward is to take sips of water and to top that up with electrolytes like Gatorade, 100 Plus. There's just so many brands out there. So make sure you're doing the right thing all the time when it comes to dehydration. But more importantly, before you even get to dehydration, please make sure your water levels are up at all times. In the meantime, we'd like to thank those who've come in today. We'd like to thank Shah Zarak Khan, who's come in to talk about Photomedic Solutions and also the work laser can do in order to help someone. We also want to thank Dr. Iqbal, Dr. Mohammad Iqbal, who's done a fantastic job handling kids, premature kids, and making lives better within KPJ Damansara. And all of you who've sent us messages and of course questions as to what you want on the show. In the meantime, if you do have any questions for us, send me an email, send it to ask@medicaltoday.my. That's ask@medicaltoday.my, and we will be more than happy to get in touch with you or to get for you someone you'd like to see appear on the show. On that note, I'm Jared Ratnam on behalf of the production team of Medical Today signing out. You have a great day ahead and a fantastic week. Bye-bye and take care.